the Strength Beyond Struggle podcast and Ending the Silence program of the National Alliance for Mental Illness, NAMI, sponsored by Access. In every episode, we deal with difficult mental health topics, including suicide. So if you're struggling, remember, you can always get help by calling 988. Welcome. Today with me is Diego Mejias, whose family went through a traumatic 2-year divorce that still has repercussions to this day. And his mother got into therapy to help him through the process. And for the last 8 years, it's kind of been a really helpful tool for you to use. But if you could help our audience understand a little bit about why you think your mother wanted you to get into therapy.
Yes. So my sister and I first started therapy at like the early stages of the divorce when my parents and I first separated. It wasn't a court order or anything. It was just my mom thought that we had been through so much that the divorce was going to be pretty confusing. So she wanted my sister and I to talk to someone, to have a therapist ready to, just someone we can talk to.
And you actually had, by that point when the divorce started, did you start having some of the social anxiety problems you talked about before with me?
I did, yes. Before I went into therapy, I had some extreme social anxiety. I remember, say in 8th grade, I would often go days without speaking to anyone. I wouldn't initiate conversations in general because I was either just too afraid, didn't know what to say, or just really didn't care. Like, that's how withdrawn I was.
And you were withdrawn because you had an abusive father who taught you to look at the world and filter it through threat. And that's one of the reasons you didn't even want to start conversations, right? You never knew what you'd get.
Yeah, exactly. He was very verbally and emotionally abusive. You never know if you were just going to walk into the room with him and he was going to find something to criticize you for. Like, you just didn't know when it was coming.
And that hurts, doesn't it? When someone comes out and it's almost like verbally punching you.
Mm-hmm.
Yeah, because you just are kind of like, wait, what? And you can never have your guard let down. And did you learn about all that through the therapy you took, that how toxic all of that was?
It's something that I learned as I went through years of therapy. It was, I want to say probably maybe like a year or two afterward, because I went through a lot of therapists, and say when I first went through it, it was just like still getting to know what therapy was, getting to know them, and
trusting the process, you mean, kind of almost?
Yes. And really it was like, when we started off, it was just me talking about things about my biological father that I just, that I didn't like. Like, there were times where, things that he said to me that I didn't like, or times where he just made me, uncomfortable. And having someone there for like the first time to say, this made you feel bad about yourself and that wasn't right. Like, that was very liberating, and it really got me to think about what was healthy and what wasn't.
Because you had somebody in your corner that was like, look, I am here and I am a person who knows a lot of people like you. And here's how these family patterns that you're living with are really damaging, hurtful, and toxic to your psyche, your ability to have relationships. It can affect your work. It can affect your choices in life. Could you explain, because therapy scares a lot of people. I have a lot of people come to me and say, how do I find a therapist? How do I even start?
Well, when it comes to if for finding the therapist that actually fits you and what you need, honestly, it really comes down to the person and what you need. Like, what I needed at the time was someone who was simply going to listen to my story, acknowledge how I felt, and just acknowledge the pain that I've been through. Over time, that changed into I needed someone to not just validate my pain, but also challenge my maladaptive behaviors and not tell me, but to guide me in where to go next.
And so, wait a minute, you just kind of stumbled over that, because it's a tricky thing, isn't it? That balance.
It is. When I'm studying therapy skills, one of the things is that they're not supposed to tell you what to do. They're supposed to guide you into, like, they're supposed to guide you through your goals, what you want to do, and to help guide you to a healthy life. They're not ones to fix you or to tell you what to do or order you around.
So that's a little hard, because if you're in an abusive situation, you don't really have the time and space and safety to figure out, what do I want? And you want to explain to people why you don't. Just why don't you have the space to think about you?
Well, at the time when I was still living with my biological father, it just I would say like it just didn't cross my mind, or it just really didn't feel safe. When I'm just in that situation with my biological father, living in under the same roof as him, I would like, it was just so terrible that I was just focusing on getting through the day. I never really had time to reflect on like what is a better life.
Or what did I have fun with today? Right.
Yeah. And that was also because like I didn't know there was another option. Separating from my biological father helped show me that there is a better life possible.
And so, and that's what I'm saying with the therapy. So you're in this situation as a child, just surviving.
Mm-hmm.
And I want the audience to understand just surviving is really toxic.
Mm-hmm.
It's very toxic.
Yeah, like if you're living just to get through the day, like that's not right. And of course, it depends on the situation, like whether or not you have enough money or not, versus
Right.
whether or not you're trying to tiptoe over eggshells and try not to like hurt someone.
Mm-hmm.
Because in our case, like with my family's case, that was the thing. We were tiptoeing so much that we couldn't stop and think, hey, why can't we just put our heels on the ground and be comfortable where we are?
So how did your therapist help you learn to put your heels on the ground and be comfortable where you were?
Well, as I said, one of the biggest things that helped me was them just sitting down, listening to my stories and just validating the pain that I've been through. Like, like no wonder you're so scared of people, or I can see how that really hurts you.
But you were saying that they also then, and then you said, okay, I have that therapist who validated my feelings. And then I moved to the next level, which is someone holding me accountable for behaviors that no longer work for me. But how did you know you wanted to let those go? Sometimes it's really hard to let those go.
Yes. And that gets, into like my, like the different therapists that I had.
Hmm.
I went through about, say, 2 therapists before I took a break just because I thought it was okay. And then I came back to therapy. And when I had my third therapist, it was like they were a good person, and they like, they listened and validated what I've been through. But at the time, I I recognized that I needed more than that, because
You didn't want to keep repeating the same behavior kind of thing. You get stuck almost in these unproductive behaviors.
more like I noticed that I was kind of like I could leave the sessions and just not think about it. There wasn't really
Well, that was
any
a
takeaway.
moment and value added to your life.
Yeah, there wasn't really a takeaway from therapy. And eventually I got to this point where I realized like I just wanted more from someone, because I had also when I started up therapy for the second time, I also had a behavioral coach who was their job was to actually help me to actually get back into the community and actually start working off that social anxiety per se. And what I noticed was that they were very honest. They would often call out the situation for what it was, and that was my aha that, oh, I kind of like that. I could, like, maybe I was hurt at the time, but I could walk away from the situation thinking I needed that.
And then your life kind of improved because you did something different. So what I'm trying to help the audience understand, and the question I keep getting from people is, number one, I'm afraid to go because I don't want to admit I'm broken.
Mm-hmm.
And number two, how do I find effective help?
Mm-hmm.
So could you kind of talk about the first one?
Yeah, the first one, that people are broken. My therapist put it like very well that, people aren't broken because you're not there to fix them. As I mentioned earlier, therapists aren't there to tell you what to do. They're there to guide you, to give you the tools to help you on your healing journey, and to help you in a way, like solve it yourself. Because when you walk out of the session, it's up to you to apply what you've learned and to turn your life around. They're there to help you, but it's, up to you to actually see the results through.
Just like with physical therapy, you had an injury. If you do the physical therapist exercises, then you might get better. But if you don't do the exercises, you won't. And that's the thing. I find in this society, these soft kind of ideas of mental and emotional health are not taken very seriously,
Mm-hmm.
even looked down upon.
They are, like, there are still parts of the world that they still don't respect mental health. I would say, like, I've seen a lot more of the newer messages that we should respect our mental health and it should be something we could talk about. But I personally haven't seen it practiced much outside of a mental health setting. And
Me neither.
yeah,
Like in businesses,
yeah,
there's power struggles within, and there's lack of conflict resolution, and there's a lack of understanding of the sensitivities that people have,
mm-hmm.
and the traumas and the triggers that everyone's walking around with, and how they can escalate the situation. So with therapy, how How did, I mean, because this isn't stuff that we sort of are taught in school.
Mm.
You got to go in with your therapist and one-on-one kind of hash it out.
Yeah, there are like a lot of people who have been through a lot of therapists because maybe they just haven't found the right one, they haven't found their needs, and that is the thing. When it comes to choosing the therapist for you, it does come down to one, knowing what you want or need out of therapy, and second, there's probably going to be some therapist shopping, because I've read a lot of stories where people have just been through a lot of therapists trying to find the right one, whether it's because they found bad therapists or they simply didn't click. Like, it is a process, but it's definitely important to know that you have a say in who your therapist is, and you can ask, hey, can I have a therapist who maybe is more honest, or maybe is just a really good listener? Because, our needs are different and sometimes they change, in my case.
Well, I'm kind of stuck on a point, because you talked about how you stepped up your therapy level to find people who held you accountable for behaviors that no longer work for you, because you knew what you wanted. But and you sort of just found that by accident, sort of by going to the behavioral coach thing. Is that kind of part of the mental health journey, is sort of accidentally finding stuff because you don't know what you don't know?
A lot of it is kind of luck, because with my behavioral coach was someone who showed me that, hey, there's a step up from what I've been getting. There's someone who can actually challenge me and try to hold me accountable for better behaviors and actions. And that's what led me to get my previous therapist. Someone was a lot more honest, helped me accountable, and yeah.
A little bit.
Yes.
But you also had to be ready for that, didn't you?
Yes. It was definitely an adjustment period. I had a lot of times where I left the session angry and upset, but
your therapist or you or the situation?
That I did, because they didn't really hold back with their observations. Like,
Nice way of putting it.
Yes, they still said it with unconditional positive regard. That's what they say.
Unconditional positive regard. I like that.
Yes. Okay. But I wasn't always ready to accept the truth or, what they saw. But at the end of the day, that's what I needed. Because no matter what, no matter how much the therapy session triggered me, per se, I could always come back and refresh, knowing that it's what I needed to hear.
How did you, after you got triggered like that? Because I've been through therapy too, and I've walked away just... They pointed that out, really. What did you use? What were some of the things you did to finally come to peace with that information?
Yes. Well, I was a very calm and self-reflective person at the time. And when I calmed down, I was able to think back on what my therapist said, and actually, I was able to actually consider it and not just
emotionally respond to it.
Yes, emotionally respond.
Because that emotions kind of they muck it up, but they're important tools, right? But once you lose the prefrontal, the logic to them, then you're just like out of control. They're in charge, and it hurts, and it can really hurt, and they drag you around all kind of places, don't they?
Exactly, yeah. And I was very good at kind of not pushing down my emotions, but being able to separate that idea from my emotions and just kind of, look at it. In a way, yeah.
And that's another thing I don't think people really understand, is disassociation, and how toxic that is when you disassociate and you don't understand your emotions and you don't acknowledge them and you don't embrace them. And that was part of your therapy, correct? Bringing it all together. Thoughts, emotions, behaviors, all are twisted together, aren't they?
Yes. My therapist specialized in cognitive behavioral therapy, which recognizes that link between thoughts and behaviors and actions, and how that's a cycle. So my therapist was very good at, taking what happened to me, how I thought about things, how I acted, and just putting it together, helping me understand it.
In a different way, though.
Yes.
Because you have so you walk into that therapy session with this idea, like, this is how it is, right? And then they come out and they go, well, really?
Yes. Like, they challenge that idea.
Yes. When you're ready to hear that question, right?
Yes. I mean, like I said, oftentimes I wasn't ready to hear that, and I would need to come back next session, cooled off. And
really, you would leave a session with a question unanswered?
Not a question unanswered, but more like I wasn't happy with what they said, but mostly because it wasn't what I wanted to hear.
Really? Well, that's honest of you. That's a hard thing to say. But you wanted it. No worries. You wanted it to be your way.
Yes. Like, at the time, like, I was still coming out of therapy that just reaffirmed that, I had been through like a lot of terrible things and that, I was victimized. But with my previous therapist, it's like, you're not a victim because you're here in therapy trying to, find a better life for yourself.
Mm-hmm. That was a good message, but it's a hard one to hear.
It is because,
Victimhood is nice to wrap yourself in, isn't it?
it is. It's very comfortable. Like you get to, like you get to acknowledge and accept what happened to you, but in a way you just kind of get to stay where you are.
Mm-hmm.
And as I said, that's what I really needed from another therapist, that I needed someone who was going to push me to not be a victim anymore, to take maybe not so much ownership, but to acknowledge what happened to me and to move past it.
Right. Because there is a way, and I want to reassure the audience, no matter how traumatic the situation was, if you want to choose to, and you have the tools, and just confirm if this is a correct understanding, you can choose to look at the situation differently and bring more peace.
Mm-hmm. And that's what like my therapist taught me. Like it was another way of looking at it, that there was a way that I could take control of the situation and, take control in my favor. That I didn't have to just be a victim of circumstances, that I could take control of my life and make it what I want.
So is that kind of the message you'd want to give people that might be in a similar situation you grew up in?
That is, like, once I get my license and become a therapist, I want to work with people who've been through the same things that I've been through, similar mental disorders, but to also give them that idea that they can take control of their life and they don't have to just take life as it is. They don't have to be a victim of circumstances.
They can actually dream and realize their dreams, live their best life.
Yes, they can get out of a toxic situation and find people who will actually support them. They can actually dream of having a good future instead of just trying to get through the day.
Wow. And how does that make you feel to have that awareness and get on that other side?
It's very, I'd say uplifting when I look back on my past and knowing like how far I've come. It's nice that I can think that way now. Looking forward, it is a little scary knowing that I'm going to be sitting down with people for an hour and hearing their deepest and darkest struggles. And I have to find a way to turn that around and help them, find a better life. It's definitely scary, but at the end of the day, I stick with this education plan so far because I enjoy being with people at their lowest points, and I enjoy being there for people and being able to help them.
And so could you tell our audience, just get them up to speed, you're currently where in your education process on this?
I am currently in my last year of my bachelor's in psychology. Specifically, I want to study to become a mental health therapist, which is why hopefully in the next year, I'll be moving on to my master's program in clinical mental health counseling.
Wow. That's an honorable profession. And I want to thank you for the wisdom you brought today as to not being afraid of therapy, that it's a tool, right?
It is. It's a tool to help you take control of your life and to turn it around, to make it for the better.
But don't be afraid of shopping for that right therapist.
No, there's definitely like, you shouldn't be afraid of it because it's, you deserve to have a therapist that matches what you need, that's there for you.
So, Diego, we've been talking a lot about therapy and what a powerful tool it's been for you and how it's actually inspired you with your career.
Yeah.
But we're also sitting here courtesy of the National Alliance on Mental Illness.
Yes.
And our particular program that we are involved with right now is Ending the Silence. And Ending the Silence actually has played a role in your life as well, and helping in your journey.
Yes. I first learned about it when I was part of my local NAMI on campus club, and the president recommended me for these Ending the Silence presentations, which they told me that it was a chance for me to share my mental health story with students at local schools and to, give them an insight into how other people have been through similar experiences and that there is hope.
And so in the process of doing those Ending the Silence presentations, and so what you do is that you're paired with an adult, just so the audience knows, paired with an adult who has the facts and the figures, and then you come on and for 10 minutes tell your story of the crisis and how you found, a way to live with it, and then why you're here to give them advice today. And so in the process of doing that, how does that help you to heal?
Well, the biggest thing was my social anxiety, because standing in front of a group of people I don't know and having to tell my life story in 10 minutes, I mean, to be fair, that takes a lot of work. and especially in front of students, which, you know, they've got their own problems. They're just trying to get through the day too, probably.
A lot of them. Well, for the poor things don't even have their prefrontal cortex fully developed. So they're just a mess of hormones. I mean, really, it's adolescence is so hard. It's a very hard time.
It is teenage years. I don't recall anyone who looked back and thought that was wonderful.
I really haven't, me neither. So anyway, we feel for you kids. So that's another reason to go back in and talk to them. And so, and you had some good response back, because the joke is, at a funeral, you'd rather be in the casket than giving the eulogy. So for you to have social anxiety and then go and talk in front of kids, I mean, that's huge healing.
It is. And by that time, like, I had worked on my social anxiety enough with talking in front of people. That was a moment where I got back into more regular public speaking. And not only was it good for challenging that, but it helped me deal, it was rewarding in its own way, because I went back to my old high school, a place where I wanted nothing to do with, because I didn't enjoy it, to say the least.
Mm-hmm.
But to go back and to just give my mental health story, to be able to come back to a place that hurt me so much, changed, and ready to help other people, it was very rewarding. I walked out the end of the day, like, just felt very satisfied with myself.
Like you faced your fear and got over it.
Mm-hmm.
And speaking of that, by telling your story, because a lot of people are ashamed of their mental health condition, ashamed of, I mean, I lived with bulimia for 42 years and I had a lot of shame about it.
Mm-hmm.
I speak about it now. So can you explain, in the speaking of it, does that liberate you from that?
It does, because it helps me put into practice something that I believe, that you shouldn't be ashamed of your mental health condition, that if you have it, it's something you struggle with, it's something that you probably need help with, and it should be okay to talk about that. So these Ending the Silence presentations also give me that opportunity to not just talk the talk, but also walk the walk.
That's, wow. Yeah. And that's probably just really healing in and of itself.
Mm-hmm.
And so how would you suggest to others your age about maybe getting involved? Would you strongly suggest that they do this if they're interested?
I would definitely recommend NAMI resources, whether they have like a NAMI on campus for their high school or their college, or even if it's just looking at the resources online. It's the people that I ran into NAMI, they've been very supportive, they've been very uplifting, and it's just a place to promote like a better life.
And to just talk about this?
Yes.
In a safe space?
Mm-hmm.
Without the judgment.
Definitely.
Yeah. And that, I'm not sure if everybody understands how healing that is.
It is, like, it's what I needed in the early stages of my healing journey, and NAMI is definitely a good place for that.
Mm-hmm. And NAMI doesn't heal you. Its purpose is to educate.
Yes, its purpose, educate and to uplift.
Mm-hmm.
So, like, similarly with therapy, it's to help give you the tools to help continue your healing journey.
And I can also tell you the kind of therapies that are available. Kind of, if you take a class, they have classes on, and I'll explain, like family to family class, peer to peer class.
Exactly. Like, even, yeah, like with those classes and the support groups that they have, they are like, there's people trained to give them and to help run like support groups, but we're not therapists in any way.
Lived experience, just lived experience.
Yes, we have lived experience, and we're here to help other people with similar experiences, and to most likely encourage them that, you know, if they need therapy, then definitely go look for a therapist.
Right. Okay. And there's NAMI affiliates in a lot of towns. We're in Payson, Arizona. You have one down in Sierra Vista?
Correct, yes.
And there's one in Tucson. So we're here in Arizona, but NAMI's all over the nation.
Mm-hmm.
And we just went to a national conference.
Yes, NAMICon in Denver, Colorado. Very fun.
You did you pushed a boundary doing that too, didn't you?
I did. It was my first time traveling out of state by myself and trying to sustain myself for a week. And it was a very pleasant experience, not just the convention, but, you know, being able to travel and meet so many amazing people.
After all the social anxiety that you suffered with, to have that freedom. So, Wow, that's awesome. Well, thank you, Diego, for being here today and for giving our audience so many opportunities to rethink tools and face their fears and live with their mental health.
Yes. Well, thank you for having me.
Yes. Diego talked about the importance of group therapy and coping with family trauma. He faced depression and anxiety due to conflicts with family members. But repeatedly, he returned to counseling and group therapy to help. He's not alone, and neither are you. if you're seeing a therapist. Lots of studies show therapy can help you cope, especially with depression and anxiety. But therapy also has a role in treating schizophrenia, bipolar disorder, addiction, and trauma. Some studies even show that both individual and group therapy can provide more lasting benefits than drug therapy. Other studies show the power of combining the two treatments. So how do you choose? Here's some guidance from the American Psychological Association. You can get all this research on our website, strengthbeyondstruggle.org. Remember, we're not doctors on this podcast. Instead, we have lived experience. So please consult with your doctor before undertaking therapy. Here's a summary of the research we found by the Psychological Association. For depression, drugs and therapy both work, but they may work best when combined. For anxiety, drugs and therapy both work, but therapy probably works better. For addiction, therapy and 12-step programs work best, but sometimes you can add drugs that reduce cravings. Eating disorders, therapy works best, but anti-anxiety medications can help. Schizophrenia and bipolar disorder, antipsychotics and mood-stabilizing drugs are important. Adding family or cognitive therapy can also help. Parent, marriage, and coping skills, psychotherapy works best. But here's another surprising finding from the American Psychological Association. About 95% of cognitive therapy is done one-on-one with a therapist. However, lots of studies show that group therapy works just as well in many cases. It might even work better for people dealing with shame and social judgment. In that case, people get great relief from finding that others are dealing with the same issues. Therefore, group therapy could reduce cost and increase access. Just a 10% shift toward group therapy would treat some 4 million more people at the same cost as one-on-one therapy. A greater use of group therapy could save $6 billion while requiring 35,000 fewer therapists. And that's important because we have a grave shortage of mental health professionals, especially in rural areas. Here are some other interesting studies. This study involved young minority women suffering from severe to moderate depression. Both talk therapy and antidepressant relieved symptoms. But at 6 months, medication was working a little better than therapy, but after treatment stopped, far fewer therapy patients had slipped back into depression. And here's another study, this one from the National Institutes of Health. Combining a host of studies revealed drug therapy and cognitive therapy work equally well for depression. However, talk therapy had much longer lasting benefits. A year after treatment stopped, twice as many of the people who had taken antidepressants had relapsed. So here's the bottom line. You don't have to gut it out. Treatment works, but you must get the help you need. Sometimes that means finding a doctor who can prescribe the right medicine. Sometimes it means psychotherapy or group counseling. And maybe it starts with a support group sponsored by the National Alliance for Mental Illness. You can find a way to connect to the NAMI chapter near you on our website, strengthbeyondstruggle.org. We hope it can also start with this podcast and the links on our website. As Diego discovered, you can reclaim your life or help your loved ones with a little bit of help. And that always starts by ending the silence.
It's okay to just be me. We're all made to be unique. It's okay to have my needs. It's okay to be me. What's easy for others are struggles for me. I do things differently. Doesn't make me broken. It just makes me me. People out there help me through, ones who care about me and you. Through my struggles I find my strength. Feels so good to be me. What's easy for others are struggles for me. I do things differently. Doesn't make me broken. It just makes me me. People helping me to get through, have their own struggles too. Even though they have their strength, they are human like me. Through these struggles we build our strength. We all want to feel healthy. Even though we make mistakes, struggles build our strength.